this annual meeting has been pretty remarkable for some of the studies that are being presented for autologous stem cell transplantation for multiple myeloma. We have a very prominent study that's being presented as a late-breaking abstract on Tuesday morning. That is LBA1 abstract, which is the final outcome of the BMT-CTN 0702 study, also known as the Stamina study. This was a large transplant study, in fact the largest US transplant study of 750 plus patients who were randomized into 3 groups. And all these patients were upfront newly diagnosed myeloma patients undergoing transplantation. After their transplant, patients in one group received lenalidomide maintenance. The second group received a second autologous transplant, meaning a tandem autologous transplant followed by lenalidomide maintenance. And the third group received consolidation with lenalidomide, bortezomib, dexamethasone, and then lenalidomide maintenance. So these 3 groups were compared for 38 months in terms of progression-free survival. And amazingly, we found that there was no difference between these groups, and they did not even stratify according to their risk status at the time of diagnosis. Amazingly, close to 85% of patients in all groups were alive at the 38-month follow-up mark, which tells us 2 or 3 important things. Number one, it tells us that most patients who received novel agent induction in the US, followed by a transplant and followed by lenalidomide maintenance alone, are doing really well. Secondly, it tells us that that arm, transplant followed by lenalidomide maintenance, is the standard, and we need to develop therapies that will be better than that arm. The current approaches of double transplant and consolidation don't seem to be as much better than lenalidomide maintenance alone. Thirdly, it tells us that the improvement in survival in myeloma, which will always be captured by PFS before that survival shows through, is looking very good for myeloma patients. Most of these patients are going to make it more than a decade median survival, because at the 38 months from transplant, which means almost 45 months from diagnosis, 85% of these patients are still alive, which is very exciting news for patients all over the country. And I think that's the single most important transplant abstract at these ASH meetings for myeloma.